So, area of the hip joint. Yes, of course, this is quite big area. So we'll talk about this in sections. Okay, so which muscles we can see in this area? We can see, for example, the Iliopsoas muscle. Here we have the gluteus minimus muscle, gluteus medius muscle, gluteus maximus muscle. Here we just see barely some sacrum. Okay, and let's go, because we have really a lot of pictures to go over. So just to reiterate, yes, we have this Iliopsoas muscle and the small sartorius in this area, gluteus minimus muscle, gluteus medius muscle, and gluteus maximus muscle. Here we see also some rectum. This white things is the fat tissue around. Yes, there's in this area of the body we have quite a lot of fat tissue inside, at least outside also. It's quite natural. Oh, and the piriformis muscle. I forgot about spotting this. Okay. So here one more time, what we can see. What is interesting, and what I did not told you about, yes, is this iliotibial band. It's a very big, very long ligament-like structure, yes, that is built with connective tissue. Okay, it's enough for this moment. So, and we'll have the same. So the Iliopsoas muscle, we have the Sartorius muscle, yes, the Iliopsoas tendon, this darker spot here, the obturator internus muscle. Of course, we have the ilium here, yes. Maybe it's easy, but let's stress it. And the sacrum, yes, this fat tissue here around, the gluteus maximus, the gluteus minimus, and the gluteus medius. So you can see that the gluteus medius is generally on the side. Okay, so here generally nothing changes, just we can stress something that we did not stress yet. So we have the rectus abdominis here. Yes, it will approach the pubic bones, and then we would see it better if you would have it in the ankle. Okay, the sartorius muscle, as you can see, becomes a bit more pronounced. Yes, the tensor fasciae latae also becomes more pronounced. The other muscles, the other structures are very similar. However, we become so low, as you can see at this spot, that we start to see the femoral head. Yes, you know that from anatomy that the hip joint is connection between the femoral head and the acetabulum. The acetabulum is in the hip bone, yes, on the connection between three bones, in the connection between ilium, iliac bone, ischiatic bone, and the pubic bone. But we are going from superior, yes, so we are going from here into this direction, so top down approach we have now, and this leads to the situation that we will have first iliac bone. We see first iliac bone because this is the most superior one. Okay, so let's go on. So as you have already spotted, we have this iliotibial band, gluteus medius tendon, this darker spot here. We see the gluteus maximus, the gluteus minimus muscle, tensor fasciae latae, sartorius, the iliopsoas muscle, so it gets to the anterior, iliopsoas tendon, this small one, the femoral head, the ilium, obturator internus muscle, and the sacrum, yes. Okay. Generally here, what has changed is that we can see far better the joint, yes? So we can see far better that is the acetabulum and head of the femur. Yeah, just like that. This is the anterior acetabular wall, this is the posterior acetabular wall. Comparing to the glenohumeral joint, this is far more stable, yeah? This is far more closed up, and thanks to it, the dislocations of the hip, although present, are far less likely. Yes, and it needs far more energy in order to start such thing. Okay. Okay. So let's go on. Here we can see even better the joint per se. So we also start to see some interesting ligaments. For example, we see the sacrotuberous ligaments. Yes. So the ligament that gets from the sacrum to the tuberous caudicum. We also see quite nicely. Wait a moment. Okay. So going on. We see this Iliopsoas tendon. Yes, generally those darker spots are some tendons. And now we see also the Rectus Femoris tendon. So we are starting to see also the Rectus Femoris muscle. Yes, tensor fasciae latae is still prominent. Okay. Yes, so not much changed. We just, one thing's changed. Now we see the acetabular fossa nicely, and we see that in some places the acetabulum is not exactly attaching to the femoral head. Yes, we have this hole, yes, that is filled by some ligaments. We'll see in a moment the ligament of the head of the femur. But this is important that only that not all of the acetabulum is attached to the head of the femur in articulation. Okay, we also start to see the greater trochanter. So this greater trochanter is generally the superior, it processes superiorly from the shaft of the femur. The muscles generally did not change for this moment. Okay, so now we see also the neck of the femur. Yes, it showed up. We get the Rectus Femoris, Sartorius, the tensor fasciae latae, the Iliopsoas getting a bit smaller. We see also some pectineus, obturator internus, the ischium starts to show up. Yes, the bone, ischium bone. The sacrotuberous ligament still here. Yep. Okay, ischiotuberosity becomes more pronounced. So ischiotuberosity, just to remind you, is this part of the pelvis on which we are sitting. Here we have the femoral artery, femoral vein. Okay, so we have this femoral artery, femoral vein, the pectineus muscle, femoral arteries, femoral vein, also greater saphenous vein, so these more veins that get from more superficial ones, but end up in a similar place. The obturator internus muscle here, the ischiotuberosity, the common hamstring tendon, yes. The gluteus maximus, we are getting progressively into the direction of the shaft of the femur, but now we see the femoral neck. Okay, the tensor fasciae latae, the Sartorius, the Rectus Femoris gets progressively bigger. In a moment, of course, it will be far, far bigger. Okay, so here we see the Iliopsoas, it's traveled a bit. Vastus lateralis is also seen, so we see more of the heads of the quadriceps. Now the Rectus Femoris, the Sartorius muscle is still there. It's quite relatively long muscle, as you can see, but we start to see the adductors of the limb also well. Adductor longus, adductor brevis, the pectineus. No, I get the adductor too big. Yes, adductor longus, adductor brevis, pectineus. Sorry. Okay. This here will be better. Adductor magnus, adductor brevis, adductor longus, and pectineus. Here we can see the Sartorius. Here we can see the Rectus Femoris, the tensor fasciolata, and still our friend the Gluteus maximus. Of course, we can see also the shaft of the femur, and some ischiotuberosity, however not so much. Those dark spots are the conjoint tendons of the semitendinous muscle, biceps femoris, long head, and close to it we have the semimembranous tendon. Okay, the Sartorius muscle. The Sartorius muscle. So, the muscles that are here are the same. Generally, nothing interesting changed. Here we can see nicely the greater saphenous veins, so these veins that are getting the blood from artificial parts of the lower limb, not only but mainly, and we can see nicely the lymph nodes. Yes, of course there are a lot of lymph nodes. We will not delve with details for this moment. Okay, semitendinous tendon, conjoint tendon, quadriceps femoris muscle. Okay, and what else is interesting? The other parts we are starting to see the emerging pattern that the quadriceps getting bigger and bigger. Okay, so nothing new. Okay, thank you.